Okay, it's done.
Okay, great. So we'll start officially around 2 o'clock, once everybody's on.
Yeah.
So anybody made hospital rounds or?
Yeah, so I see Ravish, Iris Grenek, Rita Hegde. Yeah, that's fine. So okay, so so. That was 7 minutes. Yeah, so joined.
So you were off today, Kaushik, or?
Today I was off, yeah.
Oh yeah, good. It's pretty cold out there, man.
Yesterday was cold too, yeah. I haven't stepped outside of the house today.
Srita, are you muted or unmuted?
I can unmute, yes.
All right, all right.
Hello. Hi, Varun. Can
Hi,
you
how are you?
hear? All
Yep, we can
right.
hear you.
You can hear. Okay.
Yeah.
Okay. Thank you for doing this, all of you.
Yeah,
And
thanks for joining.
we appreciate. No problem. That's this is your office.
This is a backdrop in my apartment. I wish my office looked like this.
Well, it almost looks like I can see the buildings. It's so
Yeah.
real, so real. That's a good background you have?
Like sitting in a penthouse in Manhattan.
Exactly. Yeah.
Hello. Let me see. Dr. Malhotra. Good afternoon.
Good afternoon, ma'am. How are you?
I am okay. My name is Rita.
Hi,
You
Rita.
don't. Yes.
Thanks for joining.
Well, it's a pleasure to hear from all of you. And it's our honor, actually, to see all of you encouraging and sharing what you know.
That's right. It's all about community help. Totally.
Yes. Yes, yes. So we can pass it on to those who are not here. And have you been doing this, or is this the first time?
Yeah. No, I have done a couple of TV shows also. I do regularly How to Live Healthy Heart, on ITV almost 3 or 4 times a year.
Oh, this is Indian channel, right?
ITV Gold, right? That's it.
Oh, so we miss out.
Next time I'll be more proactive and send out more, links.
That would be very nice. Please include me. I love to know what's going on and how to protect
Sure.
ourselves and others.
If this
More.
goes well, maybe with the help of young physicians with me, we can do more webinars and in regards to health,
That would be highly appreciated. Really. Very good. So, Dr. Malhotra, you are a cardiologist?
Yes, and I have been practicing for the last 25 years in Stony Brook, Port Jefferson area. Yeah, my own.
Nice. I'm glad I don't know. I don't have to know you.
That is very true.
But I'm glad to meet you today in
Rather
person.
meet at home once everything is cleared up, rather
Yeah,
than in office. That's true.
yes. And thanks for doing it on Sunday, perhaps the only day that you guys get.
Yeah, I know. Yeah, we decided.
Yeah.
Professor, I heard that you are in the Stony Brook cardiologist, right?
Yes, sir. I have my own practice, but I do go to Stony Brook and cover other hospitals. I'm actually chief of cardiology at St. Charles Hospital in Port Jefferson.
So, do you know that we have anywhere the EECP program for the heart is going on?
EECT was
EECP.
EECT program was in Stony Brook Hospital. It was very big about I would say 6, 7, 8 years ago. and there have been quite a few studies showing that it is beneficial. But because of lack of much enrollment, I don't think Stony Brook is doing it now. Not sure, Northwell Hospital still has a system that can do ECP over here.
Northwell?
Right.
Oh, where is the actual location, Northwell?
It's actually in community, it's in Nassau County, Community Drive on Long Island. But Stony Brook does not have that. The later studies didn't show that much of benefit. That's why, it was not continued. But yes, still it's a good modality for people those who have angina, chest pain, and not getting better with the regular treatment. This is an option for them.
Because don't have in the Stony Brook in the near 25 miles, so just we have to go too far.
I know.
Too far for the.
Why did you have been recommended the ECP treatment?
I look so many videos and it improves the hearts and natural bypass and everything. So without any surgery, that is the great. I think so.
Yeah, as I said, it was big many years ago, but not now. It's not, so.
It's not now proven or not now?
Yes, I mean, it definitely improved symptomatology and angina-wise. Didn't make any difference much in survival. And the exercise capacity did not change that much. That's why they're not doing it, because enrollment kept on going down and down in Stony Brook. There used to be a big program in Stony Brook, actually.
Okay. Okay. Thank you, doctor. Information.
You're welcome, sir.
Hello, good afternoon. It's Ramesh Gupta here.
Good afternoon.
Okay, so let's start the meeting. Good afternoon, everyone. Namaste. I'm Srinivas, President of India Society. So let me introduce Dr. Abhay, who is conducting this seminar for us. And we are really, highly privileged to have their time. So I leave the podium to Mr. So Dr. Abhay will introduce the rest of the speakers. We can continue with the meeting. And India Society is in collaboration with Hindu Temple. We are conducting this. So we have some of our board members on board too. Dr. Ramesh Gupta, who is treasurer here, and Pushpa Talanki, secretary, and Krupali, assistant secretary and information board director. And we have rest of the group also. We have Mr. Satyanarayana Garu. He was our ex-treasurer. I see him. And I leave it to Dr. Abhay to introduce rest of the speakers, and you can continue with us.
Thank you, Mr. Srinivas Nantajuji, current president of India Society of Suffolk County. And I actually want to thank all the board members of India Society of Suffolk County doing this effort to send out a message to the community so that we can do some community service. You'll be all glad to know that I have three very eminent speakers with me today. And we'll do a QA session with them so that we can answer most of your questions, what you have in your mind. I want to introduce Dr. Varun Talanki, who is a chief resident in neurological residency in Stony Brook Hospital. And we have Dr. Kaushik Mantani. He's actually the chair of Department of Family Medicine at Peconic Bay Hospital, program director of transitional year residency. Also, he's an associate professor at Zucker School of Medicine. Lastly, but not the least, definitely Dr. Srita Rajapet. She is director of population-based health initiative. She's also deputy division head of graduate medical education, primary care lead for post-COVID clinic, and also clinical professor at biomedical informatics. And I welcome all three of you, and thank you so much for joining. We'll start our QA session. Myself, as Srinivasi told, I'm a practicing cardiologist. At present, I'm a chief of cardiology division at St. Charles Hospital. And it is my privilege and honor to do this session. Thank you so much. So let's start with Dr. Kanti. I'm going to introduce you guys with your first name, if it is okay. Varun, tell me about this COVID-19 SARS-CoV-2 virus. It has caused so much of havoc, pandemic. What is the reason behind that? Why our body immune system was not able to take care of it? And what are the different kind of immune systems our body has to fight these kind of viruses?
First, so the COVID-19 pandemic was caused by the SARS-CoV-2 virus. This is a virus that was first identified in Wuhan, China. It was found in late 2019 to cause a cluster of pneumonia cases, and since then it has spread rapidly throughout the world. So this particular virus, it's been found through testing to have close genomic similarities to bat coronaviruses. So it appears that this particular virus either spread directly from bats or through an intermediate source. So the question is, why is this virus so infective compared to other viruses we've seen in the past? This is a novel virus. It's a virus we've never seen before. And for that reason, we do not have built up immunities to fight it. Compared to other viruses that we've seen in past history, this appears to spread very easily and remain in the air for longer periods of time. And for that reason, it's very infective. Our bodies already have many levels of defense against viruses. Our primary source of defense is something called innate immunity. And this is our first line defense. This includes our physical barriers, such as our skin, but it also includes other components such as cells, natural killer cells. These are already in our bodies that you're born with to fight and attack viruses. Now, the next layer of immunity that we all have is something called adaptive immunity. And this is our next layer of defense. So this level of immunity is a form of learned immunity, which develops over time. So as you get older, you're exposed to various harmful bacteria or viruses in your lifetime. Antibodies and other components tend to build up. So as an example of something, part of the adaptive immunity is something called antibodies. And antibodies after an illness or an infection can take days or weeks to form. And so together, the innate immunity and the adaptive immunity work together to help us fight COVID-19.
Thank you, Varun. So as he very well said, because of a novel nature of the virus, our body didn't recognize it. We didn't have any antibodies built up. That's why it is very infective and causing this pandemic. Elderlies, as we all get older, our innate immune system goes down, and that's one of the reasons why elderlies are more prone to get infection. Thank you, Varun. I'll switch on to Sarita ji. Could you please highlight what is the different kind of preventive measures which we should all to cut down the exposure and to make sure that you don't get infected? And also, could you please tell me, a lot of people have confusion about what is the difference between quarantine and isolation, and how long we should quarantine and why? Sarita ji.
Sure. So there are three main things we want to keep in mind to prevent ourselves from being able to contract the virus. One is to wear a mask, and we want to make sure that we're covering our nose and our mouth when we wear the mask. Two is to stay at least 6 feet apart from others. That's about 2 arm lengths. And three is to avoid crowds or poorly ventilated areas. In addition, we want to be washing our hands often. And when you're washing your hands, it should be for at least 20 seconds. So you want to sing the happy birthday song twice. And we also want to be covering our coughs and sneezes. So you had asked, what's the difference between isolation and quarantine? So isolation separates those who are sick from those who are not sick. Quarantine, on the other hand, separates those who were exposed to the virus in this case, but who have not developed any symptoms, and we are watching them to see if they develop symptoms. If you develop symptoms, we want to remain in isolation for at least 10 days while our symptoms are improving and we've remained fever-free for at least 24 hours without the use of fever-reducing medication.
All right, thank you so much. What kind of symptoms we look for which could tell us that we may have acquired the infection?
Sure. So there are quite a few on the list. Things to keep in mind are fever, chills, new loss of taste or smell, diarrhea, nausea, vomiting. And these symptoms can show up anywhere between 2 to 14 days after exposure, but more frequently show up about 5 to 7 days after exposure.
All right, thank you, Sarita ji. Now I'm going to go on to Kaushik. Could you please, let's say I have infection, do I have to stay home, or at what time I should go to the emergency room? What are the lab tests we can do to see if we have an active infection or if we had any past infection, and what treatments are available? If you can just run down that, please.
So most patients that feel they have an infection, it's good to know, for sure if they have an infection or not. And the reason for that is because you want to know whether to quarantine, just like Shrita said. I know many people have this home pulse oximeter also, and we have to take it with a grain of salt. It's not 100% accurate, but if you're very short of breath and if the pulse ox is reading less than 90%, there's definite cause for concern that you should seek evaluation. Regarding the tests available, there are 3 tests that I wanted to talk about. So the first test is the rapid or antigen test. So actually the term antigen is the more prevalent term, just because the PCR also is relatively rapid. Antigen tests for the viral protein or antigen. And the benefits of this test is it's very cheap and it's fast. And in fact, many outpatient offices may be able to do it in 15 minutes, urgent care or primary care offices. And also they can, they don't need any fancy equipment to get the results. The performance depends on kind of the circumstance in which it's used, and there's a whole lot of variables, including how sick you are. If you're not very sick, it's not going to be the best test. It's going to have, what we say, a low sensitivity, meaning it's a bad test to rule out if you have the infection or not. It's still a good test to rule in. If it's positive, there's a high chance that you have the infection. So that's a 99.5% chance on average. These numbers also vary based on how much of the population and community has it. But if you have, the big point is for the rapid antigen test, if you have a negative result, you should still be very cautious, and you can't take that with 100% certainty. Many urgent cares or offices, they offer a rapid test or a PCR. And in the hospital, the PCR test, that's the next test I want to talk about, has a pretty good turnaround time, 3 to 4 hours. But in the urgent care, it's likely sent to another lab and have a couple of day turnaround time. But for all intents and purposes, the PCR test or RT-PCR test is the gold standard. That's the best test we have. Has a very high specificity and sensitivity. That is, it'll rule in or rule out infection with a very high degree, not 100%, but approaching that. And the reason that's the situation is that it's going to amplify any of the RNA and genetic material of the virus. So even if there's a little bit of it, it's pretty good at amplifying it. PCR is used in forensics a lot for DNA and amplifying. And like I said, the typical turnover time in the hospital is about 3 to 4 hours. It does need some expensive laboratory equipment, so offices generally don't have it. And it's highly specific. It's a great test to rule in infection if there's the right circumstance, but it does not distinguish between a replicating virus and remnants of the virus after an old infection. So if your job employer is asking you, they want to see a negative test before you can return, there's no such thing that exists. This test will be positive for weeks and weeks, maybe even months. And that does not mean you're infectious. It just means you have the remnants of the genetic material that can be picked up on this PCR test. The third test is the antibody test. So you just have to take this with a grain of salt. Firstly, to make antibodies takes at least a week's time. And, and the antibodies last in your system for probably a few months, 3 to 4 months. And again, I'm just cautious in how I word that and how I quantify that. The antibody test is really a good test for surveillance of a disease or a population. For example, if you wanted to see maybe in the early pandemic in Wuhan, China, was the prevalence in the community a certain percent or not? The antibody test, is a good test to kind of survey that snapshot about how many people had the infection.
All right, thank you. So just to summarize, as Kaushik said, we have 3 different tests: antigen, we have a PCR test, and we have antibody. To see if there's any active infection, we got to go for the antigen or PCR. Antibody is more for surveillance. The other thing is none of these tests are 100% accurate. So as Kaushik mentioned, PCR is the most accurate diagnostic test we have. Rapid tests are not very accurate. Their accuracy is close to 40 to 50%. So you go by the clinical scenario. Clinical picture is more important. If you think that you have infections, you might as well quarantine yourself or isolate yourself rather than waiting for the test. Secondly, if you clinically looks like that you have COVID infection, but the test result is negative, you can go for the repeat test and see if that picks up. Thank you so much. So if everybody who has infection, they don't have to run to the emergency room. If you have persistent shortness of breath, fever is not going down, or if you have pulse oximeter, which is showing oxygen level is low, less than 90%, then yes, you can go to emergency room. And Kaushik, could you please tell us what kind of treatment they can get to get benefited from it in the ER in the form of antibodies or any other antiviral treatment?
Yeah, so, the course of the disease is really, the way I think about it is it's 2 phases. Phase 1 is when the virus replicates a lot. And in that phase, the antivirals will be best. The biggest one that we're using is remdesivir. To block viral replication, that's important to have early in the course of disease. It's not as effective, 2-3 weeks after infection. It's not going to work well because the second stage of the disease is inflammatory. So the body is trying to have this intense battle with the virus, and as a result, it releases a lot of chemicals. We call them cytokines, and this in turn is really uncontrolled and ends up damaging some good tissue as well. So in this situation, steroids, specifically the one that was studied a lot is dexamethasone, is the best to calm the inflammatory response, to preserve, your good tissue as well. And I just wanted to point out that this whole pandemic's kind of been a good, it's given a good example of science in real time, and a cheap medication like steroids being effective was really refreshing to see, and was nice to see that something that's very cheap could be really effective.
Thank you. So also, anybody who has COVID infections, more than 80% of them, they do get better. Not everybody gets hospitalized. And again, we have to be careful that when you have infection, make sure that you don't give this to other people. That is the key. We need to avoid that. And then you'll be fine. We talked a lot about COVID virus itself, how can we prevent, and what are the treatments available. Now, which actually more important topic to me is, let's talk about vaccination. Who should get vaccines? What kind of vaccines are available? Should we get it or not? What are the high-risk groups? So we'll talk about that. We'll switch some gears here. And first of all, I am going to ask Varun actually. So could you please elicit what kind of different vaccines available here in US or elsewhere? And who should get vaccinated and then we'll go from there.
Sure. So there are two currently FDA approved vaccines in the United States. These are the Pfizer and Moderna vaccines, which are both mRNA vaccines. So the goal of the COVID vaccine is to allow your own body to generate antibodies to prevent illness from COVID. So the Pfizer vaccine is currently indicated for everyone 16 years and older. Oh, can you hear me?
Yes, I think.
Oh, I think I was muted. I think I was muted, right?
Yeah.
Okay, I'll start again. Yeah.
Start again, please. Unmute yourself and start again, please.
Okay, sure. So there are currently two FDA approved vaccines in the United States. These are the Pfizer and Moderna vaccines. These are both mRNA vaccines. So why do we need vaccinations? So the goal of the vaccine is to allow your own body to generate antibodies to prevent COVID illness. So the Pfizer vaccine is indicated for everyone 16 years and older, and the Moderna vaccine is indicated for everyone 18 and older. This includes everybody, including patients and individuals that are immunocompromised. So the only thing to look out for before getting the vaccine is if you have a previous history of severe allergic reactions to mRNA vaccines, or you're allergic to any of the components of the COVID vaccine, you should consult with your medical professional. Otherwise, it's basically, we encourage you to get the vaccine if you qualify for it. Something else that comes up that we're asked about is what is herd immunity? And it's a term that's often tossed around. And so herd immunity refers to the indirect immunity you can have from a disease that occurs when a sufficient percentage of the population is already immune. So this population can be already immune either through vaccination or from previous exposure. So in other words, herd immunity would occur when enough of the population is already immune and there's no significant risk of developing COVID in the remaining non-immunized group. So another question is, what percentage of the population needs to be immune before herd immunity is achieved? And the truth is, nobody knows the exact answer to that question, but the accepted ballpark estimate is about 80%. So really 80% of the population would have to be immune before there's no significant risk to the remaining 20%. But obviously that number is not truly known.
So Varun, if I already had infection in the past, I may have some antibodies. Why do I have to get vaccinated? Do I need that?
That's a good question. So despite the fact that even if you've had an episode of COVID-19 and you've had a positive test proving that your illness was from COVID-19, it is still recommended that you receive the vaccine after the acute course. So after you're no longer having fevers, shortness of breath, it is recommended that you get the COVID-19 vaccine, because there is some benefit that you can get in prevention of future illness.
All right. Thank you, Varun. So dear viewers, as we have said, the key word is herd immunity. The virus level is not going to go down in the community until unless we have herd immunity. And that is not going to happen in 1 or 2 days. As Varun said, probably close to 75–80% of the people have to be vaccinated to have antibodies. Only then we can be feeling safe that, yes, I don't have to put the mask on, I can go out, but it is going to take months for that to happen. I encourage everybody should be taking vaccine. It has been already given to millions of people right now. And yes, there are going to be some side effects of it, but it is working. So I encourage everybody to take, only then we'll be able to achieve that herd immunity, which we are talking about. Thank you, Varun. So Sarita ji, could you please go over a different kind of vaccine which is available? I heard about AstraZeneca or Johnson & Johnson. Are they good also? And what are the kind of doses? Why do we need 2 doses for this to work?
Sure. So there are quite a few different vaccines in the pipeline. The most common ones that have really come to the phase 3 clinical stage at this time include the mRNA vaccines, which Varun mentioned. This includes Pfizer and Moderna's vaccines. Then there are also adenovector vaccines. This is the AstraZeneca one, as well as Janssen, which is part of Johnson & Johnson's group. And then the last group is a protein subunit or adjuvant vaccine, which is the Novavax one. So to really understand them, we could probably go into a whole separate discussion, but I'll focus on the mRNA vaccines since those are the ones that are approved in the US at this time. So to do that, we need to understand the virus a little more. So SARS-CoV-2 is the virus that causes COVID-19. It has an S or spike protein on it, and that actually binds to our cells, and that's what really wreaks havoc in our body. So when it binds, for example, in the respiratory tract, we may have shortness of breath. When it binds in the gut, then we have, diarrhea, vomiting, etc. So now that we know that, we think about, well, how is the mRNA vaccine going to work? So the mRNA or messenger RNA vaccines have a strand of genetic material called mRNA inside a special coating. This special coating allows it to enter our body at the vaccination site. And the mRNA basically provides a message to, or instructions to our cells, and it tells them how to make the spike protein. But it's smart. It only teaches it to make a part of it, so that way we don't, create the whole thing and cause illness in our body. So once it gives those instructions to the cell, it actually breaks down, and the protein that's made helps build that antibody response that we want. At no point does it actually alter our DNA. It doesn't become a part of our genome. And I know that's been a concern for many people.
Thank you so much. So as Sarita ji said, please, 2 most important points. It does not become the part of your genome. We are only giving a little bit of genetic material in the form of mRNA, which will translate to proteins and help us, our immune system, to build up antibodies against spike protein. It is not going to be the part of your genome. That's number 1. Sarita, also as a layman person, I want to know, is this a live virus? May I get infection from it?
Great question. So this is not a live vaccine. There are some of the more common live vaccines that we've heard of are like the measles, mumps, rubella one, but this one specifically is not a live vaccine.
So is it safe to give it to immunocompromised people?
Yes, it is. It has been tested in those who are immunocompromised. I mean, we still are going to do further studies, but at this time, we are encouraging those who are immunocompromised to get the vaccine.
Thank you. I'm going to ask Kaushik, please answer these questions for me if you can. So what are the side effects we look for? I know there's a 1 dose and there's another dose, booster dose. What are the side effects you look for, and how can we deal with those side effects?
Sure. So almost everybody, about 92% of people will get injection site pain. And often it's worse with the second dose. So Moderna and Pfizer are about 2 doses, like we mentioned. So that's something to expect, and that's okay. And then, you have fatigue, which is almost 70%, headache, and about 63%, muscle pain, and maybe about 59%, and sometimes joint pain and chills in less than 50%, somewhere in the 40s. So these are things to expect. Don't freak out when you get them. And I just wanted to share, I had the fortune of getting the Pfizer vaccine, and on the second dose, I definitely felt many of those common side effects I just mentioned. I took one Advil, so I think as long as you have no medical issues or you can't take an Advil, you can take an Advil or Tylenol to reduce some of those side effects. Drink lots of water and rest. That's what I would recommend.
Okay, thank you. Could you, I know that not a whole lot of people can get vaccine at one time. There is a shortage of it. Could you please explain about this phase 1A, 1B, 1C? Why have this categorized it? We want high-risk people to get vaccine earlier than the other people. Could you please explain about that?
Sure. So firstly, yeah, the vaccine is scarce, and I think leaders across the world had a difficult decision to make. We mentioned that a lot of these vaccines are 2 doses. I guess in theory, they could have doubled their population by giving 1 dose. But I'm very proud that the priorities were for doing this right. And you really do get much more efficacy with the second dose and longer immunity. And I'm proud that the scientific leaders really advocated for that. Eventually, everyone hopefully is going to get the vaccine. It's just we have to do it right so that the most people are saved in the most efficient way. So they did this phasing of eligibility for the vaccine. And I just wanted to precursor, it's really location-based, state-by-state based, and often these phases are changing rapidly. But phase 1A, that was healthcare workers, nursing home residents, and people in long-term facilities, EMS workers, people in the ambulance responding to 911 calls, funeral home workers. This was phase 1A, which has already been mostly given out. Phase 1B just started on January 10th, and these are the people who are greater than 65 years old. So right when this came out in New York State, first they said greater than 75 years old. Within a couple hours, they changed that to greater than 65 years old. So that's just a good example of how dynamic these are changing. Teachers and educational workers, public transport workers, first responders, they're all in the phase 1B. And then phase 1C, hopefully by March or April, is going to be 16-year-olds to 65-year-olds with high risky medical conditions. So just speaking about that, high risk medical groups, of course, are those who are older age. We said greater than 65. Anyone with history of lung disease like COPD or other advanced lung disease, those with cardiovascular disease, those with type 2 diabetes, obesity, sickle cell disease, chronic kidney disease, those with solid organ transplants, and those with cancer. These are especially the high-risk groups. So this is going to target those who are 16 years old to 64 with these high-risk medical conditions. And then after that,
when you are relaxing, thinking,
hopefully by summer,
you are not wasting time. And that is also equally important.
Could you please,
You need that
all
time.
the viewers to mute themselves, please, to cut down the background noise. Thank you so much. I'm sorry, Kaushik. Could you please continue?
Yeah, that's all I wanted to say.
Okay.
Hopefully by summer, we'll all get the vaccine. And, the reason I believe in this 2-dose vaccine rather than maybe splitting the doses is I do think that this pandemic is going to last some time. And eventually those who nobody knows how long the efficacy is going to last, but there may be booster shots and things like that, but we got to do it right when we give the vaccine. And, I trust the scientific community to figure that out.
Thank you, Kaushik. I'm going to add just one more thing about this, the side effects or maybe symptoms once you get vaccine. This is what you call it as reactogenicity. That means once you have redness in the arm or little chills or fever, this means that your immune system is responding to the vaccine, so which actually is a good news. Thank you, Kaushik. Also, lately, viewers, you have noticed that there are mutated strains have come out of COVID-19, which everybody's kind of worried about it. Was seen firstly in UK, and then now you have a South African mutated strain. It's actually now prevalent in USA also. I'm going to ask Varun to explain what this mutated virus is, and do we have to worry about it? Yes, we all don't have any definitive answers, but we'll throw some light on this mutated virus. And will this vaccine work against that mutated virus or not? Varun, please.
Sure. So basically, there have been a bunch of mutated strains that have appeared. So the one in particular that has gained a lot of attention is the one that was identified in the UK. So this particular strain of COVID-19 is a mutated virus called the B117. This particular strain has been found to spread more easily for reasons that are not well understood yet. There are also more than 20 variants that have been identified of the original virus. Many of these also affect the spike protein, which is the primary target of the COVID vaccine. So I think people are worried, appropriately worried about this, and it's important that we take this seriously. We fully expect that we're going to see more strains appear with time. However, none of this should discourage people to get vaccinated. And the important thing is that there is a lot of benefit you can get from the vaccine, as the strain that's the majority is the primary target of the vaccine. Now, with regards to this particular strain, the UK strain, this is the one that's been the most studied. There have been some early studies that have come out in the last few weeks showing that our current vaccines are in fact effective against this strain. However, there's still more work to be done to tell for sure, and there's still more work to be done regarding some of the other strains.
Thank you, Varun. So as Varun said, as of now, this vaccine should work against the mutated vaccines. It may be less effective, but it'll work. Second thing, this virus vaccine mismatch, it is not something new. I'm a bit encouraged about it, but this has been happening in the past also with the influenza virus. Every year, influenza virus changes its strain, and that's why even flu vaccine is not 100% protective. So this is virus vaccine mismatch has been there in the past also. Yes, we got to deal with it and come up with a better vaccine if need be in the future. But as of now, we do know that this vaccine will be effective, may not be as protective as against the novel COVID virus, but it'll be effective against the mutated virus also. Sarita ji, I need to know, it has been an issue about the pregnant females. Do you think pregnant females should get vaccinated? And why pregnant females should get vaccinated? Are they more prone to get hospitalized? And please throw light on that.
Sure. So we are encouraging pregnant women to get vaccinated. They have been shown to have higher risks of complications related to their pregnancy if they are infected with the virus. The American College of Obstetrics and Gynecology actually supports that recommendation. And there are approximately 30,000 women or pregnant women who have actually been vaccinated with the vaccines and are being followed currently. So that's key. There were also, during the actual trials for Pfizer and Moderna, people who actually got pregnant during the trial. For example, during the Pfizer vaccine trial, there were about 23 participants who got pregnant, about half of which had actually received the vaccine, and there were no adverse events or complications reported during the pregnancy. So we are encouraging it in pregnant women.
Thank you. Also, as of now, for children less than 16, as Varun has mentioned, it has not been recommended that they should be vaccinated, but we'll see how the future goes. So with this new mutated strain, what do we have to do? I think we got to be even more careful in regards to taking all the preventive measures. And even if you have vaccine done, that does not mean that you can go out and not wear masks, not washing your hands. All those preventive measures are very, very important. And I would encourage everybody to continue doing so even more now because we have this muted strain. But let's all be very, optimistic about it. And this is a big beast. We all will work together. And I'm sure by the end of this year, we should be able to, put it behind. So this was a cool QA session I had. Thank you so much for all of my three speakers. That was great talking to you. Srinivasji, if anybody has any questions at this point, we can answer the questions.
I have a question. This has to do with the vaccine that is available in India. Does any of you know anything about it, and how much efficacy does it have?
Right. So I don't know much about it, but I know that this is not an mRNA vaccine. It has what they are claiming is pretty good efficacy. The Pfizer and the Moderna vaccines are also going to be available probably by February in India to be taken there. Over 1 million Indians have already taken this vaccine, and so far they're doing good. But that is the only one which is available right now. And it is also not as expensive as compared to Pfizer, which I think is $33 per vaccine. Moderna is, I think, 22. This one costs $6 per vaccine. But it has good results so far.
You are talking about the one that is being made in Pune?
Yes, and that is not mRNA. If I'm not wrong, that is more of a adenovirus encapsulated vaccine.
Okay, thank you.
You're welcome.
Professor, I have Harish. I have one more question. I already texted my question, because if we take 2 doses of the vaccine, both the part 1 and 2, so after taking, how much we are safe and we can protect, we can go outside freely, or we need the protection, or we can travel, or we cannot travel?
Very good question. So first of all, why we need vaccine, as we already said, even if you have infection, your body will develop antibodies, but we don't know how long the antibodies will protect you. So that's why you should get vaccine. And once you get this vaccine 2 doses, it gives you the level of antibodies about 1.9 to 4-fold what you get it after the exposure. So the antibody level is really high, and we think that at least for about 6 to 8 months is going to protect, if not more, about a year. Even if you have taken vaccine, as I have mentioned before, everybody still has to continue wearing masks, has to take all the preventive actions till you get that word herd immunity, till 80% of us have been vaccinated. Only then the virus load in the community is low, and I will feel safe to walk around without mask or doing get-togethers and all that. Till that time, especially with this new mutated virus, please, prevention is still the key, and it's very, very important. Thank you.
Okay, thank you very much.
Just one thing I want to add. Pfizer vaccine, after the second dose, they say about 9 days afterwards, the placebo, those who got a fake vaccine and those who got the Pfizer, that's when the gap really starts to approach different lines. So that's to say, after your second dose, 9 days after, if you get the Pfizer one, your immunity really builds up much higher than the one with the placebo. And then the Moderna one, I think about 2 weeks after the second dose, you can feel a little safer, but you should take every precaution.
Thank you, Kaushik. That was a good point. So even after you have taken vaccine for at least 2 weeks, your body has not developed antibodies. It could take some time for the immune system to kick in. Thank you.
Just one other thing I wanted to also point out is I can sense, many of you guys are worried that the phases of the vaccine are not really rolling out, so they're available to you. And the question about the vaccine in India, maybe if that's available to you or something like that. But I know that Shrita's in, there's a study in Stony Brook for the Novavax, and just wanted that to be, made aware to us. There's a clinical trial going on in Stony Brook for the Novavax. Could you talk about that, please?
Sure, absolutely. So Stony Brook is a host site for the Novavax phase 3 clinical trial. And full disclosure, I am a co-investigator. We will post the information to everyone about access to the clinical trial. It is open for anyone who has not had COVID before and has had or is considered high risk or has had or have other chronic medical conditions. So especially if you're in outside of the 1B group currently and would really like a vaccine and are considered eligible, I would encourage you to learn more information about this, and that can be accessed through the Stony Brook website, which we'll provide for you.
Thank you. And Sritaji also has done work research for the websites which are available, which you can go and register yourself. We will actually post it also and email all of you. So you can, it'll be handy for you. You can go onto the site and then register yourself. Yes, it is a little frustrating for the community. Not everybody is getting vaccines right now, but probably things will change soon, very soon in the future.
We have Mr. Mihir and Mr. Dutt on the questions.
Yes, sir.
My question is there a difference between the treatments that is being given to the VIPs and the Aam Janta? I mean, how did the president walk out in 3-4 days, and how did all those big guys, the VIPs who got this, they seem to be fine. I mean, we don't have a single instant of one of these VIPs getting into ICUs and things like that. So is there a difference between the treatment that is being given?
Kaushik is gonna probably answer.
Answer that. So first one, I think it was Donald Trump, right? Everybody, knows that. The second, I think the difference in him and us, and in medical school, you're always taught treat everybody like their VIP, like their family. First thing is he had very good access to medical care, and the second, that his oxygen level was even approaching that low. They took measures to move him or any VIP to a more monitored unit. And then he did end up getting, he got steroids, even though, it's controversial if a patient who is not needing oxygen should get steroids. The study actually showed those who have moderate COVID, there's more harm with steroids. So I don't always, and even in my own personal practice, there's a VIP I actually cringe a little bit, because sometimes they'll ask for more, and more is not always better. So that's one thing that I just think was an observation. And the other thing is he did get this antibody treatment, antibody infusion, which some of the emergency rooms and some of the hospitals are offering. So this is really something that we as community should know, and we should be aware of, is all of us are eligible for this antibody infusion. So I'm a member of Northwell, and I can only speak on behalf of what we can offer, but I believe Stony Brook Emergency Room also has infusion therapy for antibodies for those meeting criteria, but it's meant for those who are in the higher risk criteria that we were talking about before, greater than 65 years age, those with comorbid conditions like cardiovascular or kidney disease, sickle cell disease, cancer patients, those types of patients. And there are two types of antibodies that I especially know about, but it made, each site may have their own antibody. I don't know which site has which. So one is this, it's a long name. It's called bamlanivimab. I just call it BAM for short. And you can, if you feel like you meet that criteria, you can ask your doctor, can I get that BAM antibody? In Northwell, in Bayshore, they have a site at South Shore University where they're giving this antibody infusion, and it's directed directly against the spike protein. So earlier I was talking about the two phases of infection. There's the viral replication, and then there's the inflammatory. So this is beneficial as soon as possible to prevent the virus from replicating. And the data on it has actually been very solid. You know, vaccines are a treatment, but even more important are the treatments that can prevent the progression. And these infusion therapies are very much underused, but they did well in the studies in preventing viral load, which they measured, and they also measured those who had to go to the emergency room after getting them. The other one is a combination antibody infusion. It's casirivimab and indevimab. So that's the one actually Donald Trump got. It's made by a company called Regeneron. So that's the way to remember that one is, if you're feeling sick and you're high risk, you can ask your doctor, can I get either the BAM infusion or the one that Trump got? And I do really strongly believe these are helpful. Their side effects are very minimal. You can get a little bit of fever. Of course, you can get anaphylaxis to anything. And then if you get these infusions, you can't get the vaccine for at least 90 days. But this is something you could
I have
tell.
a follow-up question. Do you have to ask for the treatment? I mean, what if you don't know?
No, they will give it.
Can I interrupt you? I have two more here waiting for a question, Mr. Mihir and Suresh Gupta.
Yes, please, go ahead.
So my question is, once somebody gets the infection, do they have any immunity, and for how long? So the reason I ask is because I got infected by COVID during last October, and I was hit pretty bad just because I have asthma. So do I have immunity, and if it does, how long? And the second question is, just to bring it up fast, is this vaccine like a flu shot that you take every year, or is just going to be like one-time shot for your lifetime?
So to answer the first question, as I mentioned also, once you get the infection, you will get some antibody response from the body. Depending, every individual is different, but it does not last that long. It may last for, we don't know, it may last for 2 months or 3 months or even 15 days. It depends upon what is the titer of antibody it has been generated by your body immune system. So that is why even if you got your COVID-19 infection, you still should get vaccine, because it is not going to give you lasting immunity against. You could definitely can get reinfected again. So just antibody depends on how much is the level of antibody your immune system has built up, but even that doesn't last that long. So you should take vaccine for that. And what was the second question?
Is the vaccine like one time, or is it going to be like a flu shot that you have to take?
So we don't know, but Pfizer and Moderna, they're saying anywhere from 6 months to a year, it should last. But again, if 4 months down the road, we have a very mutated vaccine, it may not work, we may have to take it. My feeling is, I'll ask other speakers to join. My feeling is it probably is going to be yearly thing, the way we do it for flu shots.
Yeah, I wanted to add something. In the history of diseases like viruses, there's only been 3 or 4 vaccines that have been completely eradicated I'll say for the US, and smallpox, polio, and actually the first SARS was one that we kind of got lucky with. But all of these other vaccines, measles, mumps, rubella, varicella, Ebola, they do have pockets of outbreak here and there. So they're not fully eradicated. And I do, not to sound like a pessimist, but I do feel like this SARS-CoV-2 is going to have little pockets here and there for some time. The statistics that's what it kind of reports. And I do expect the chance that we'll be getting mutations and not.
Kaushik,
You can unmute and speak.
Kaushik, unmute.
Oh, that's all I had to say. I'm talking too much.
Thank you.
No. I just muted the rest of the noise.
Any other questions?
Yes. I can ask Krupali to read a couple of questions she has.
Yes, we have few questions. Kiran Gupta ji wants to know She has got vaccinated. I'll read her question word to word. If I get vaccinated, can my kids or others that are not vaccinated still get COVID from me if they are unmasked?
Okay. Sarita ji, you want to answer that?
Sure. So we're not sure that if you get vaccinated, if you still can transmit the virus if you're asymptomatic. We hope that those who are vaccinated have that degree of protection and that we don't transmit it to others in our household. But that's why until we learn more information, we still encourage the use of masks, hand washing, and even in our own household, we still encourage distance between family members.
So as she said, very important. Yes, even if you have gotten vaccine, you may still be carrying the virus and you can expose to other people in the house. So taking precautions still is definitely essential. Thank you.
We have one more question. I have taken the first shot of the Moderna vaccine 1 week back and my arm still hurts. Is that okay?
What they are saying is up till 3 to 4 days or 5 days, it can last. But maybe if it is more than a week, she should definitely talk to her physician and get it checked out. You want to make sure that there is no secondary infection in the site of injection, which is not likelihood, but she should definitely talk to her primary physician and get that checked out.
The other thing that we also have is for those who are having side effects, we have something called the VAERS system, the Vaccine Adverse Effect Reporting System. So anyone can report side effects that they're having. They can just call the number available. You can quickly Google it. We can also provide that number to everyone. And when you get your vaccine, they also give you a handout for an app or web and text-based program called vSafe. And vSafe will prompt you with questions. When did you get your vaccine? What symptoms are you having? And sort of basically follow up with you on how you're doing. And this data helps us determine, how severe side effects are for individuals, allows us to follow those, especially who are pregnant as well, and is a great way for us to get information from the public who's been vaccinated. So I'd encourage you to sign up for vSafe when you get the vaccine.
Right. vSafe and VARS, these are the links which you can actually tell them that these are the adverse effects I'm having, and they can report it. It'll be in the database. At least it'll help us for the future.
Thank you. I have one more question. I'll read two questions. One is from Vatsal. What is the current protocol for COVID treatment? And the second question we got from Medha is, how long is the recommended quarantine period before meeting people outside of the household? Is it 7 days, 10 days, or 14 days?
Okay, I'll answer one and then I'll ask Kaushik to add in also. So quarantine, what they're saying is it's better to anywhere from 10 to 14 days. If it were me, I would go for 14 days, make sure that we are safe. That is the time period which we should do. And Kaushik can answer the other question.
Yeah, current treatment protocol is, if there's worry, come to the hospital. We have to think, what can the hospital do that, a loved one at home cannot? And the answer is, they can provide oxygen, supplemental oxygen, and then they can provide these two treatments that we touched upon. One is that antiviral, remdesivir, and the other is the steroids, dexamethasone. So, the other thing also in hospitals that, if any of you know anyone who has a severe infection, a big worry is also preventing clots because of all the inflammation. It's a disease that's known in autopsies to see that it forms a lot of microclots. So generally, they will give a higher dose of a blood thinner and sometimes even aspirin on top of that. So those are the big treatments that you should expect if a loved one's in the hospital.
All right, so I'm sorry, but this is
plasmas. We can get the plasma from the guy who already got infection, give it to the guy who is sick. It gives you some protection.
Right.
So plasma, it's we don't know how much plasma is in each donated unit. It probably will not hurt, but it could be a lot of volume. Plasma, I'm generally not giving a lot because ideally you want someone with a high dose of antibodies, but you're not certain based on the unit that you're donating. So plasma, I haven't given much. Early, we were thinking it was promising. Studies are conflicting with it.
Yeah, Dachi, actually, I want to also add that for the local community, Kaushik said Stony Brook is giving, Northwell is giving, even St. Catherine's Hospital and Mather Hospital, local, these are the hospitals which will give you antibody treatment in an emergency room. If you're sick, you go there and then they'll give you antibody treatment. You don't have to ask for it. This is kind of a norm treatment now that everybody will get it. At the time of when Trump was there, it was an expensive thing. That's why he got it at the time. But now it is available. Even St. Catherine's Hospital has it. I know that I go there, so you'll get it over there.
Can I just, sorry, this is Kavita, Vatsal's wife. I was the person who'd asked the question regarding the current protocol for COVID treatment. So when I asked that, I specifically wanted to know, like, I have a couple of people that I know tested positive for COVID. So right now, what the doctors usually end up saying is if you can manage the symptoms at home with the Tylenol and all the regular immune boosters and all of those, like the home treatments, then just stick to that. Is that what is the norm right now in this part of the world? Because that's definitely not the situation in the other part of the world. In India, where they're doing the CRP testing, they're doing the D-dimer testing, like the blood test and everything. But is that not what's a standard protocol in this part of the world? Is that my understanding still correct?
So if you go by what the guidelines are, and they were all set by Dr. Fauci and all, is that, as I said, 80% of the people will get better on their own. They don't need to get hospitalized and all that. So even if you have symptoms, you don't have to rush. You isolate yourself, you take Tylenol, hydrate yourself, and see how it goes. Watch for any bluish coloration of your lips. Watch for any persistent shortness of breath or cough or persistent fever. Or if anybody has pulse oximeter at home, they can check the oxygen level, even though you got to be careful how to do that. And by the way, when you do pulse oximeter, please don't have your nail polishes on. That'll interact with the oxygen level reading. So if you feel sick, then you should go for the CRP and ferritin and all this blood work. If by 80% of the time, these symptoms will get better on its own. So yes, you got to have a close eye at the symptoms, see how you're feeling. If you are feeling better, then you can definitely wait. You don't have to get ferritin, CRP, and D-dimer test and everything done. But if you are sick, then yes, you should go for it. Ferritin and D-dimers, as Kaushik also mentioned, when they come to the hospital, nowadays they are saying that there is micro clot formation, which is a big deal, and they give Lovenox and other blood thinners, which actually has shown to improve the survival for hospitalized patients. But again, not everybody has to rush there. If you can manage the symptoms on your own, that's good. If not, then you go with the other couple of things is people talk about vitamin D, which is some studies have shown if you are deficient in it, there is no harm in taking vitamin D. That'll help you. In the hospital, there was one study showing very high dose of intravenous vitamin C infusions. But again, some part of the world is doing it, some are not. Other thing which you can do is vitamin C or taking N-acetylcysteine. There is one study which they're saying at home is it's better to lay down prone rather than on supine position. Prone, when you lay down prone, it improves the circulation to the lungs. And also, as I said, vitamin C, vitamin D, you should take it. Zinc, some people, they do take it over the counter. There's no harm in taking it. You can try all of these remedies rather than doing this ferritin and all that. Yes, if you're sick, then you need that. I hope
I just wanted to add, I don't think there's any space for ferritin, D-dimer, and CRP if you're going to be home, just like you mentioned. inpatient, it makes sense to trend these. All of those tests, there's many causes that can raise those. For example, if you work out and you're sore, your ferritin might be a little bit high from the inflammation from that. And there's millions of different causes that affect those tests. In the hospital, they're useful to trend. So 3 days ago, my ferritin was only 200. Now it's 1500. Oof, the inflammatory phase must really be revving up. I better make sure I'm treating that. That's the utility of those tests, but a one-time snapshot of those tests is not useful.
Any other questions?
Yes, we have few more questions. Uday wants to know that do they have to wear 2 masks to be safe?
Sarita ji, what do you say?
So, so generally we encourage a mask. It doesn't have to be double layered. The key is that you've bought at least a high quality mask that has is less porous, so to speak. So if we think about like using a cotton mask, that's considered effective. And there are fancy masks out there, all sorts of different materials with rhinestones, etc. I mean, the goal is to at least have a cotton mask that is covering your nose and mouth that's at least a single layer. And you don't need to wear an N95 in public unless you are a healthcare worker and working in a hospitalized setting, and you would wear it in that setting only.
So, as she said, you have a cloth mask, we have a surgical mask, and as Sarita ji said, N95 and KN95 mask. When you're going out, so far as you have a good surgical mask, you have 30 to 50% protection. The protection goes higher if you use KN95 or N95. But your question is very right. I mean, maybe if I go out, I may put 2 surgical masks instead of 1. More you put in, 2 is better than 1. Maybe it'll give you a little more protection. So if I ask my kids, I may say use 2 surgical masks rather than 1. It's my opinion.
Next question is from Veda. If I got the Pfizer vaccine as my first dose, can I get the Moderna vaccine as my second dose or vice versa?
It is not recommended as yet. If you have taken Pfizer, you should be taking the Pfizer one. The reason for that is that, yes, both are mRNA, but they're little different kind of mRNA. One is with the lipid molecules, one is not. So it's better to stick with both until unless guidelines change.
There are some instances in which people may not, have a record of their first vaccine. For some reason, they're at a site, they can't get the second dose of the vaccine. And in those rare instances, the recommendation is to wait at least 4 weeks from whichever possible one that you got the first time, and then get whichever one is available in your location. We don't have the data on covering, taking 1 dose of one and a different dose of another. But in the instance that we may never be able to figure out what your first dose was, it's okay to wait 4 weeks and take the dose that is now available to you.
Okay.
But then you have to take 2 doses of that then, after.
The current guideline is actually you don't have to take 2 doses. You just take the one where you left off and you don't start the vaccine series over.
Okay. Next question is from Harshit. He likes to know if someone got COVID-19 and was hospitalized for 8 weeks and now got released from the hospital, but still is on and off to take oxygen. So does this mean that the lungs never got recovered?
Okay, it's a very good question. Actually, in clinical practice, we are seeing people, though, still have some effect, getting still short of breath, getting still tired. Some people didn't even get their sense of taste or sense of smell back. Kaushik can also add to it. There is some injury to the lung parenchyma when the infection happens. Sometimes it takes time to recover. Every individual is different. Definitely those who have COPD or asthma or underlying lung condition to start with, they'll have more, slow recovery time as compared to other people. But yes, we have seen people, those who still get short of breath, their oxygen level gets lower. Can it cause permanent? Yes, it's a possibility, but the rate of recovery is kind of different in different individuals, depending on what your medical condition is.
So right now, I also work with individuals who are having long-term sequelae from having COVID, or basically chronic symptoms. What we've seen is that approximately 10 to 30% of the population may have chronic symptoms that last for greater than 12 weeks. And again, as Dr. Malhotra mentioned, it is done on a case-by-case basis, but breathlessness and fatigue are the most common chronic symptoms that we see. And we typically monitor you over time and support you with medications and inhalers to enhance that recovery process.
Okay, thank you,
At
doctor.
Chronic Bay, we have pulmonary rehab, so that's another option. Is I would highly recommend asking your doctor if there's any pulmonary rehab centers. That's kind of a dedicated rehabilitation for your lungs, more specifically, and they measure pulmonary function tests and they have some data to go by. But I don't think we know the answer exactly if it's going to be permanent damage or not. I think it's still fresh in this pandemic to fully answer that.
As you know,
Thank you,
as
doctor.
of now, there are only, I think, 4 or 5 people those who got lung transplant because they could not recover from COVID at all. A couple of them have survived, a couple of them haven't survived, even after lung transplant. So, and could it be chronic or permanent? We don't know. There have been studies showing that it may even be in other organs. It may last for months in other organs of our body, but we don't know as yet.
Okay. Next question is from Lavanya. Is the vaccine safe for those that are on blood thinners?
Is a vaccine safe? Yes, it shouldn't be a problem. Those even take Coumadin, Eliquis, aspirin, or Plavix. It's okay to take vaccine. The syringe does not cause significant damage, but yes, you got to keep an eye on it at the local injection site.
Okay.
Cold compressions work.
Okay. Any idea when Johnson's and Johnson's, I'm sorry, I lost that question. Any idea when Johnson's and Johnson's vaccine is coming from Ramesh Gupta? He has heard that it requires only one dose.
Johnson Johnson only requires one dose, but as Varun has mentioned also that as of now only 2 FDA approved. I don't know. I mean, maybe in late March it'll be available. I'm not sure. I don't know about that.
Okay.
There's some guesses it may come late February, but definitely around that time, late February to late March. And they have 2 studies. They have the study for 1 dose and study for 2 doses. So that's when they're hoping to conclude their studies, is end of February, and then the scientific community will debate those results and make the best choice for what comes out of those studies.
But I would encourage everybody, don't wait for, whatever vaccine is available now. I think you should go for it.
Okay. Thank you, doctor. Next question from Medha. Do states require a state ID to get a vaccine? For example, if you just move to a new city or someone is visiting you long term, can they get the vaccine in the new state where they are visiting, or only is it available in their home state?
Rita, you want to answer?
Sure. So that's going to be dependent upon state rules, but generally a state identification is not required. It has been encouraged that every person have access to the vaccine. So in New York State, an identification card is not required.
Thank you. Given a choice of vaccine, anyone better than other, since I'm younger than 30 or 40 years old?
As of now, we know Pfizer, Moderna, they claim their efficacy is close to 90, 94%, maybe 1 or 2% here and there, but they are pretty close. So to me, if you take Pfizer or Moderna, does not make any difference. I think they're both the same for all practical
That
Yeah.
that question came from Pradeep. I don't have any further questions, but I would request the community, if you have any questions, please make sure you give us before you leave the group. Please leave us with your email and questions. We can always get back with the answers. But for now, doctor, I don't have any other questions.
So
All right.
Datti, if you have any questions further, please go ahead now.
Yeah, I'm actually worried with. I take so many medicines for so many ailments, and then I'm a user of a CPAP also. I'm practically at home. I'm even scared to go out. So perhaps you might want to advise. I mean, I use CPAP, and if I should, God forbid it shouldn't happen. If I get, if I contract it, then what? It's pretty scary.
Daji,
So
I do agree with you, Daji. This is, and it's a pretty bad scenario. I see my patients, and you said the right thing. If anybody who has medical conditions using CPAP, they have coronary artery disease or blood pressure, diabetes, smoker, if they get infected, they are more likely to run into trouble getting hospitalized and all that as compared to other people. So yes, all the more reason for us to vaccinate, them and to take more precautions. Maybe not going out of the house or whatever it is. Using a mask all the time. It is, and in my practice, I have seen many of my patients, 80 years old. Unfortunately, they couldn't make it because of COVID infection. It is a disaster zone in the hospital. So I always say prevention. This is actually the right time for all of us to do this. Prevention is always better than cure.
yeah, and you are the perfect person to get these antibody infusions. You don't have to be sick. The second you test positive, the antibody infusions are approved for mild or moderate. They're not really given in the hospital. So as soon as, God forbid, if you were to get sick, you should be pursuing those antibody infusions, and then definitely you should be pursuing vaccination every day. I know many of you guys have been. My own father has been struggling to get an appointment for the vaccine, even though he meets that stage phase 1B criteria. But keep advocating for yourself. Ask your primary doctor to keep advocating for yourself as well.
Thank you.
I have a quick question regarding how to build the immunity. Is there anything you guys suggest that we do in order to just safeguard our immunity system level, whatever you call it, other than, exercising? And I like to do pranayama, and I find that very useful. So I don't know whether any of those who are attending this workshop, whether they do or they have realized that it is extremely important to de-stress yourself by just simply taking long inhalations, holding the breath and exhalation. Other than that, if you have anything that works to build the immunity, I would like to know that.
Well, two things which I can tell is having your balanced diet with all the nutritional supplements what you need, and doing exercise on a regular basis. It has definitely shown to boost up the immune system. And as you said, yoga or meditation, pranayam, whatever helps, that absolutely do that. The other two things was vitamin D for those who are vitamin D deficient. I think that works, or taking zinc or vitamin C. Other speakers, if they have any other input.
I completely agree. I think it's always generally living a healthy lifestyle. So diet, exercise, reducing stress levels, and living the best life that we can.
Yeah, I would add sleep to that. I think sleep is underrated. A lot of us like to watch TV at night and then we can't sleep.
Yeah.
But we should try to get 7 to 9 hours of sleep and preserve our sleep hygiene as best as we can.
Actually,
You guys mentioned the
that
prawn.
if someone has cold and bad throat symptoms, but the person didn't get the COVID for a few days, and then later on he gets it tested and it comes positive. So quarantine starts from the first time when they got symptom or after the result?
So isolation will start from the day that you tested positive. And in that case, that individual would have to stay separate from everyone else because they're symptomatic. But it starts from the day that you test positive. If you were negative but still having symptoms, you may be considered to still have COVID. You just have a negative test. At that point, it starts from the first day in which you had symptoms. And we would encourage repeat testing.
Okay,
please
thank you.
Please do it for 14 days to be safe.
14 days after the test come positive.
Or when you have symptoms.
Or any like symptoms, but they didn't get it tested, but later on they got tested and
if you have
okay.
symptoms, let's say 3 days down the road, you got tested, you are positive, then you got to isolate yourself from that day onwards. Do it at least for 10 to 14 days.
Okay, thank you.
Thank you very much to all of you. It was really very, very enlightening.
I want to thank the whole board of India Society of Suffolk County.
Hold on 1 second, Dr. Malhotra-ji. We have one more question from Mr. HNS2.
Sure.
Okay, that's it. Do you have any questions, ma'am? Okay. Okay, go ahead. So there. At this time, let me request Dr. Srita, if she has something to share, I can make her the host. Otherwise, we can send the slide to the community. So whatever you guys would like to do, I mean, I can make one of the speakers host, Varun, Dr. Varun or Dr. Srita. Or Kaushik, do you have access to that file or?
Not on my current device.
Sure. So if I'm made a host, I can share my screen and
Okay.
share the slide. Otherwise, we'll definitely email it.
Yeah, so we'll try to share it. So if any technical difficulties, we can share with the community later on with the email.
But I want to thank Anand for your all hard work and all the members, those who have put this event together. Thank you so much, all of them.
Can I ask last questions? This is Beena Kothari.
Binaji, please.
Ji. So there are actually two questions. Basically, if we want to travel outside of New York or outside of state, I know for safety we need to have vaccine for ourselves and others. But is there any rules or any laws do we have to have required? And then second question is, I have seen on television there was few cases where people are losing their smell, and second things, they are losing their taste, and they don't even know themselves they lost their taste and they lost their smell until somebody in a family, like one case I saw, a 2-year-old child actually saved their mom, their family. And other case was the dog came and dog smell and dog support the whole family to take out from the house. So what I mean to ask you a question, like, how do we know? Like, we don't even know we have no taste and we have no smell, and we don't know if we have any other symptoms like a COVID. So what should we do in that scenario until somebody tell us, hey, what happened? You got positive, or you should go for the test.
So what you are referring to, Binaji, are asymptomatic carriers of the virus. So you probably have virus, but you don't have much symptoms, and then you don't know whether you're carrying or not.
Exactly.
That's the reason why you take all the precautions to protect other people. You're going to make sure that we wear masks, hand washing and social distancing and all this stuff. If you keep on doing that, you are actually helping other people so that they don't get infected from exposure from you. So prevention comes handy in that. I'm sorry, that's the answer?
I think this is the answer. Yes. Thank you so much. Thank you, doctor.
The moment that you do actually notice that you have loss of taste or smell, though, then you are considered symptomatic. And then that's when we encourage being tested, starting the isolation protocol. The majority of people are said to have those symptoms improve, that loss of taste and loss of smell. Those who don't regain that within a couple of weeks may have more persistent symptoms. And it's something that's currently being studied. There are some research trials looking into the use of omega-3 fatty acids or fish oil tablets to help improve that loss of smell or taste. But that's really only a study, and it's not recommended to routinely use those medications to improve any of those symptoms.
Great, thank you.
You had also asked about travel guidelines.
Yes.
So I would encourage you to explore the New York State Department of Health website, which will be shared with everyone through one of our slides. It is dependent upon the state in which you are going to and the state in which you reside. So New York State, for example, says that if you travel outside of the contiguous states, meaning our borderline states, then you must be tested prior to leaving. And then upon your return, you must remain in quarantine for at least, I believe, 72 hours and must have a COVID test at that time before you come out of quarantine. New York's guidelines are quite strict, so I would encourage you to follow your state guidelines before you consider traveling, and especially upon return.
Beautiful, thank you.
I agree, especially New York State, they're very stringent about it. And as Sarita said, when you go to another state, you got to follow their guidelines also, what they are recommending. Because every state has their own guidelines.
Thank you, doctor.
Thank you, doctor. I just, on behalf of the community, I've got lots of message from lots of people thanking all of you for giving them such a good knowledge on the COVID. They're really thanking, and they're expecting that we do one more session till the herd community is brought in. So on behalf of the community, I wanted to thank each one of you for your hard work. I know you guys have put in a lot of time, for this call. Thank you.
Thank you, everyone.
Certainly our pleasure. Thank you for having us.
Mm-hmm.
I second that. Thank you very much.
So unless the community has any more questions, so it's open now. We still have a couple more minutes. So if anybody has any last minute.
I also suggest that, we should do more webinars, not only about this, other health issues also. It'll be a nice tool to interact with the community and help them out.
Just an observation, here in Texas, we get the COVID test report after 4 days. How is it in New York?
It's again here 3-4 days.
Yeah, 3-4 days.
Yeah.
That might be crucial, right? That might be crucial between life and death.
Usually takes 4 days.
Yeah, unless you're in the hospital, then, it comes right away. But you're right, it may take 3 days or so to get the result out.
I'd say, for the test that takes a long time, which is the PCR test, it's worth it because it's a very accurate test. And
PCR takes 3-4 days.
PCR, right? The rapid
otherwise,
one.
Rapid test only in 10 minutes they tell you.
Right. And in the meantime, while you're waiting, just isolate yourself and be cautious.
True.
So some people are adding into the chat, is the rapid test reliable, or do you think we should do the PCR test? Kaushik, do you want to talk about that more?
Yeah, I mean, I don't want to say I'm biased, but the PCR test, you get a very good probability. The numbers are specificity of 98+% and sensitivity of 95.2%. Whereas the rapid, the specificity, which is to rule in, is 99.5. It's a good test to rule in, but the sensitivity is only 56.2, which is a bad test to rule out if you have the disease. So I think for me personally, I would say if you can get both, that's great. You can go to the urgent care, get both, have a little peace of mind, especially if you're positive, it's good to know right away, and then wait for the second one. But if I was offered one or the other, the PCR is more desirable. And just like Dr. Malhotra mentioned, still nothing is 100%, and we still all have to be cautious.
Doctor, how many days for the PCR test to get the results? 3 to 4 days, or just in the PCR?
Yeah, that's what it sounds like. It depends on, these urgent cares or outpatient places. They don't have a direct access to a fancy lab, so they have to drop it off in their lab box. There's some car that comes, picks up the specimens, drives it to the lab, depending on the timing. Once in the lab, there's a line for there may be other tests in the PCR machine. So it's variable depending on the situation. The rapid test, you can do in your office, which in the primary care's office, there's just a reagent that they put the swab into, and it turns a certain color. But you do sacrifice some accuracy with that.
Okay, sir. Thank you, doctor.
I have a question, doctor. If one was using a nasal spray like Flonase, would that affect the report? I mean, do we have to stop using the nasal spray before going to the test, or would that have a bearing on the test?
So far as I know, I don't see any reason why you cannot use Flonase. I think it should be okay for you to use. The virus, basically, if you're going for PCR, they're going to do the nasopharyngeal swab, which is a part of the throat behind the nose. So they have to go all the way back in. And then I don't know if anybody has any input, but I don't think Flonase should cause problem.
I had heard one report that an ointment, Bactroban ointment, reduced the accuracy of the test. I don't know about Flonase, but I think a good take-home point is none of these tests are 100%, and we should know that.
Thank you.
Dr. Shrita, I made you the host. If you would like to share the screen, if you have the slide, or
Are you able to view it?
Yeah, we can see it.
Yes, we are.
We can post it on our social media also then, actually, right?
Yeah,
Sure.
so
And I'm happy to talk about it very briefly. So the interesting thing is there's a webinar coming up on January 27th. Basically, the Advisory Committee on Immunization Practices, which gives us all of our recommendations and guidelines regarding all vaccines, will be having an in-depth conversation regarding COVID vaccines on that day. There are clinical resources through the CDC website for healthcare professionals, as well as those who are wanting to learn more about the vaccine. The Infectious Disease Society of America has a really lengthy FAQ section. It does go into a lot of details if you're looking for that detail or scientific input. So I would encourage you to check that out if that's of interest. The next one is the New York State run COVID-19 vaccination site. So this is part of our New York State Department of Health website, where you can learn about where to go for the vaccine if you're eligible, and also learn about guidelines in terms of travel, symptom management, reporting vaccine adverse events, etc. And the last resource is to learn more about the Novavax phase 3 clinical trial that's sponsored at Stony Brook.
And Shrita, just one question. Generally, the precedent in these clinical trials for vaccines is they do notify you at some point if there is a placebo or the actual vaccine you got. Is that generally true with many of these trials?
Correct. In general, they will eventually notify you about whether you received a vaccine or placebo, especially in our current climate. I can't speak of the other trials, but for example, Pfizer and Moderna did reveal those who had gotten placebo, so that way their participants had the opportunity to get the vaccine if they hadn't.
So that's another great resource I think we should just point out is you have nothing to lose by joining that trial, especially while we're waiting if we're not in phase 1A of distribution or phase 2 of distribution. This is something to consider and I think the community should know.
Thank you, Dr. Srita, for sharing your very important information. So we would also like to send this out to the community.
Sure.
I saw one question, one query. Is rapid test the oral swab test, or is it similar to the PCR, which may be nasopharyngeal?
Okay, but
So I think there's both types, but most of the tests I've been seeing are nasal. Does anybody else have experience?
Right. Most of them are nasal, but for some rapid, they're also using saliva and getting the results from there. But again, you know, as Kaushik said, you know, it'll reduce the sensitivity of the test.
बारिश हो गया एक तो भरा हुआ चाय खाली पी नहीं सकते क्या उसकी जगह नहीं है
Srinivas, Uncle, is there any way to make me a host as well? I had some information I would love to share.
I'll stop sharing.
At home. Yeah, that's true. रात में मैंने आधा डाला पहले पी के देख आधा पैकेट था वो आधा ये पता नहीं जरा सा कम
किरण जी, रमेश जी.
या हेलो आवाज म्यूट करो सॉरी Sorry.
It's okay.
Okay.
We are getting hungry too. Okay, Dr. Kaushik, you were saying something?
Oh yeah, if I can have sharing privileges,
yeah, I can make...
I wanted to share about the infusions.
Oh, okay.
Just so people have their eyes, they can recognize it next time they hear about it.
Shrita has control now.
She's Shrita has to make you.
I stopped sharing.
I think you have to
I can forward the email to you too.
I think Sriniji, you have to allow him as a co-host.
Yeah, I gave the host to...
Here.
Let me email you, Shrita, and then you can
Try
share.
it again.
And I can
I changed the setting to multiple participants can share simultaneously. See if that works again.
Okay. Oh yeah, nice.
Allah.
Okay, can you guys see my screen?
Yeah.
Yes, sir.
So these are just the fancy names for the antibody treatment. BAM and Regeneron, those were the ones I think are easy layman's terms. And this does talk about the, the criteria and who is high risk. This is like, the Northwell resources, but I know Stony Brook in their ER as well, and St. Catherine's also, it seems, is doing it. But this is, this is being underutilized, and I think that we all need to be aware of this and spread the word that those who test positive who are high risk, the data has been really impressive in preventing progression, preventing hospitalizations.
One is from Eli Lilly, right? Regeneron and Eli.
Yeah. BAM Lanimivab is Eli Lilly, and then the other one's the name is Regeneron.
I don't know why did they come up with such a complicated name, man?
BAM and Trump.
Just one more question came in. So very interesting one. Is the mortality rate high in US due to diet or any specific reason?
What they're saying is in India, the rate is much less as compared to Europe. And one thing which I feel is that Asians, and they have been exposed to so much of, dust and bacteria and viruses. I think their immune system is better, responds better to as compared to, Western style or European and American. That's what I think. Also, there is a strain, maybe a little different strain, mild strain in India as compared to here. That's the other they're talking about that could contribute. But yes, in Europe and USA, we have quite significant mortality as compared to other part of the world. Not that the treatment is bad here, but that's how it is.
I think we also have to take into account from a population health perspective, how effective are we testing in other parts of the world, right? If we're not accurately testing or reporting on the number of deaths, then it will appear that there are fewer deaths in other countries where in actuality they just may be higher but not reported.
Very true.
Anybody else? Any other query? So we have very ample time from our speakers. So okay. If nobody has anything, so I take this privilege. I really, really, really thank you guys. So all the doctors, Dr. Abai, Dr. Kaushik, Dr. Shrita, Dr. Varun, for your valuable time and the guidance and the information. So, and the community is overrun with your support. I mean, so I see so many thank yous here, so I cannot read out all the names. We have at least about 59, 60 participants. So at least, even if it is multiplied twice, so then it's going to be 120 families, at least in the community, have got good knowledge of what is COVID and what is vaccine and what are the effects and what's going to do, what not to do. So wonderful, so beautiful questions. And Dr. Abhay has spent a lot of time, and really rest of the community. I mean, so all the four speakers, and we have a few people from the organization. We have, so this India Society is in the neighborhood and also in collaboration with the temple is, so we have one temple located in Selden. So with their support, so we have been able to do this. And we will have more sessions probably depending on the speakers. We can do multiple things. So it's not only the COVID, like Dr. Abhay suggested, doing other things. So we can definitely make use of all the speakers. So Dr. Shrita, Dr. Kaushik, Dr. Varun, and also request rest of the community, if they have any physician in your family, so please suggest somebody who is expert on any field so we can have their sessions too. So please think about it. And I myself as a president and Pushpa as secretary. So Pushpa is silent somewhere. So, and you saw Krupali. Krupali is here. Beena ji, she had some questions. So Dr. Abhay is also part of the team, India Society team. And we have Dr. Deepa Sangwan, Dr. Shobha Menon, Dr. Gupta as a treasurer. He is also here. Dr. Nanji, so he is on the call too. And Priya Srinivasan, she has been helping us with all the technical support. Pushpa is on the screen now, you can see. And Sudha, Radha, and Vatsal. So I thank everyone, and especially Krupali. So she took a lot of efforts. I mean, she and Pushpa, they both put in a lot of efforts in bringing this. And also the Selden, so the temple here in. So they supported us with this Zoom. And special thanks to Zoom for allowing us to do. And also the Optimum, without any interruption, we could do it. So usually we do a lot of other programs from the temple, educational seminars. And for the kids, we have Balavihar and everything. And once in a while, we have these interruptions, but probably they were afraid of doctors, I guess. So there's no interruption today from Optimum. So I really thank them. So Krupali, can you say hi? And Pushpa and Ramesh is here. And we have Duttji, who is our guide, counselor, advisor for the India Society. He has been continuing. So he is there sitting in Texas and still supports us. And we have rest of the crew also. Satyananji is here, who is our biggest supporter. And Nanji is here with his Arjun brother.
But I want to personally thank Pushpa ji, Priya. You know, they really worked hard on that, and everybody else.
Yes.
Thank you. We couldn't have done without you all also. So thank you so much.
Team effort.
Yeah, we can send, if anybody has, the community, if anybody has any questions, so please send an email to the, so you got the India Society email or anyone. So then we can definitely get back to the speakers and get more information if you would like to have anything. So we would be happy to help you out.
Sure. Can I share the email? It's indiasocietysc@gmail.com.
Thank you, Krupali.
I just wanted to also say, I felt the duty to do this, and I actually asked Srinivasan a few times if he can add me late, because, you guys are all our people. We're one of you, and, we wanted you to be aware of all the updated information, and it's very rewarding to try to educate what we know and try to get you the same treatment that Trump got.
No, we are very happy to have you guys, the next generation, to be taking part in this, because you guys have to take hold of this. I mean, so down the line, you are going to run these organizations. So either it's India Society or a Hindu temple in the community, it's for the community. So it's your participation is more important than us.
That's true, but Srini bhai, you're still young, man.
I think it's a retina camera on the iPad, I guess.
So
if everybody agrees, so we can close the session if nobody has anything.
I will say thank you very much. It's a very nice session today. It's very great. And
thank you, everyone.
Thank you all. So we'll see you again in the next session.
thank you.
Thank
Thank
you.
you.
Take care.
Thanks. Bye.
Take care. Bye.
Thank you, everyone.